everyone, welcome to our channel. This is Dr. Tracey McCarthy, psychologist, attorney, and educator. What we're going to be focusing on today is bipolar disorder, and the focus is going to be on what is clinically known as the manic episode. And so we're going to focus on the 7 signs and symptoms of the manic episode so that you would know it if you are experiencing it, or if you know someone who is experiencing the symptoms of a manic episode related to bipolar disorder. Now, the first thing that we're looking for, just so that this overarching theme, is that we're looking for a distinct period of abnormally and persistently inflated, expansive, and irritable mood. So it could be either one of those 3 things: elevated mood, really high, an expansive mood, or an irritable mood, and abnormally and persistently increased goal-directed activity or energy. And we're looking to see if these symptoms last at least 1 week and they are present most of the day, nearly every day, or for any duration if a person has to be hospitalized. Now, the other thing we're looking for is, during the mood disturbance and the increased energy activity, we're looking for 3 or more of the signs or symptoms that I'm going to be sharing with you. Now, we're looking for 4 if the mood is only irritable. So if what you're basically seeing is an irritable mood in the individual, then we're looking for 4 or more of these symptoms. And we're looking for them to be present to a significant degree. And we're looking to see if it represents a substantial and noticeable change from the person's usual behavior. So the way that they normally behave, is this a substantial change from that? So the first is inflated self-esteem or grandiosity. This person is really high on themselves. They have really inflated self-esteem. Their self-worth is really, really high, very grandiose, thinking they can do all sorts of things, and just really, really inflated sense of who they are. You might see them and think of them as being sort of like an egomaniac during this period. The second thing is a decreased need for sleep, and this is very important. The person will often go for a day or 2 without sleeping, or feel rested when they've only had a few hours of sleep in a night, just feel totally rested, as if they've slept for 8 or 9 hours after only sleeping for about 3 hours. Number 3 is the person is often usually more talkative than they would normally be. And sometimes you'll notice that the speech is pressured, like they're just talking, and can't stop, and it's coming out fast and pretty furious. Another sign, number 4, would be flight of ideas, or a subjective experience that the person's thoughts are racing. So flight of ideas, they're talking about one thing 1 second and just out of nowhere skip to a totally different topic, and can do that for a period of time. And so just going from topic to topic to topic, things that may not even be remotely connected. The other thing is distractibility. Now, this sometimes gets confused with an ADHD symptom, which of course is distractibility. So you do have to, as I always say, you have to tease these things out and make sure you're looking at a manic episode versus a symptom of ADHD. So when you see this distractibility, basically what you're seeing is that the person's attention is easily drawn to very unimportant, irrelevant external stimuli. They are responding to things that are just really not that important, and a very difficult time staying focused on what it is they're supposed to be focused on. Another thing that you will see often is an increase in goal-directed activity. You can see this whether it's in the social atmosphere with family and friends, whether it's at school or at work, or sexually. And you might also see psychomotor agitation, so sort of purposeless, non-directed activity. So what also looks like fidgeting and moving around and just being very, very active and getting things done and fast and furious again, moving around a lot, just really involved in a lot of activity and often very fast paced, which might be also tied into being kind of irritable when this is also going on. The seventh thing is excessive involvement with activities that have a high potential for painful consequences. And so these are often dangerous activities. So the person might be involved in sexual indiscretions and really foolish and inappropriate business ventures, just all sorts of things they might just kind of jump into that are not going to be in their best interest in the long run. They might also be involved in things like buying sprees and really dangerous sporting activities and physical things that they just might get involved in, and just excessive involvement in these types of activities over that extended period of time. Now, one of the things we're looking for also is that the mood disturbance, because the manic episode is considered a mood disturbance, we're looking to see if it is sufficiently severe to cause marked impairment in either social functioning or occupational functioning. So in their relationships with other people, again, with family members, friends, romantic partners, we're looking to see if there is, marked impairment in that social functioning, or in the occupational sphere at work, in the workplace, or if these behaviors are sufficiently severe to necessitate hospitalization to keep the person from harming themselves or harming someone else. Or we might also see some psychotic features. So we'll look for that too. Is the person hallucinating? Are they having delusions? Because that inflated self-esteem or grandiosity can also sort of morph into symptoms of delusions of grandiosity. So you want to watch out for that. And the other thing that we rule out is we want to make sure that the episode that we're seeing is not attributable to the psychological, physiological effects of a substance, for instance, cocaine. We're looking to see if this episode is occurring absent abuse of a drug, use of a medication, or some other treatment, or another medical condition. Now, we're also looking to see if this full manic episode emerges during antidepressant treatment, which you'll often see that occur. So these are the 7 signs and symptoms and features of the manic episode for bipolar disorder. So this provides a very concise description of it. You can know it when you see it, or at least think you see it. And we hope this information was helpful. If you have any questions, comments, or thoughts, you can put them in the comment section. Again, we look forward to hearing from you. Remember, knowledge is power. See you soon. Take care.